Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic with Technique Tuesday, and we're continuing our theme this week of exercises for knee pain where the knee is responding to flexion. So that is where you're bending the knee. Extension is where you extend the knee, and some people's knee pain does respond to that. And we did a previous series of 5 videos for a progression on knee pain that responds to extension. But this week it's flexion, so bending the knee. So if you're having pain when you squat, lunge, get out of the chair, sit, any kind of knee pain, this might be beneficial for you. We've done 3 videos prior to this one that you might want to look at first before trying this video. Okay, so I'm going to show you an exercise called mobilization with a movement for tibial internal rotation. So it's kind of technical jargon, don't worry about it. I'll just show you how to do it. It's pretty easy to do. So if you have limited or painful knee flexion, so that means it hurts when you try to bend your knee and it feels like you can't bend it that far, this might help for you. The way to do this one, the ultimate way is you're going to put, I'll still do my left knee. I'll do both so you can see what I'm doing here. Right knee first. So you'll put your foot up on a chair or something. I'm going to kind of do the pasty white male leg real quick. So just so you guys can see. So foot is up here. So I'm semi-loaded. You're going to take your hands this way. This is called the tibia, your shin bone. You're going to grab up really high on the shin bone. And then keep that bone right there directly over the center of your foot. Just like that, directly over the center, so it's not inward or outward, directly over the center of the foot. You're going to grab really high on the shin bone, and then you're going to twist inward, okay? So you're twisting basically toward your other leg. Twist inward. The first thing you get is you take up skin slack, and then from there you just twist a little bit more. So you're not doing a death grip and trying to rotate the heck out of your knee. It's just a real subtle motion. Take up the skin slack, twist a little farther, and then from there you just repeatedly bend the knee. Okay, 10 to 15 times. Keep the tension on that internal rotation constant. Don't twist and let go, twist and let go. Okay, it's constant internal rotation. And I just go forward, back, kind of a rhythmic cadence. Okay, forward and back, 10 to 15 times. It should be pain-free. If it's not pain-free, then you might want to think of a different technique, okay? I'm going to show this on the other knee too, just so you can get the idea of what internal rotation is. So internal rotation is you're taking and twisting it toward the other knee, or toward the inside, toward your midline. So if we did it with the left side, left leg is up here, you could do it on a chair too. Woohoo! Okay, and then so you're going to get the skin slack, grab up high, take up the skin slack, and then rotate a little bit more. Dead center of that shin bone is right over the dead center of my toes, and I go forward. And I'm holding that internal rotation constantly. Okay, I'm not letting it up. 10 to 15 times. Interestingly though, usually it works best to have the grip up here high on the shin bone. I see this every now and again, but I worked with the guy yesterday, and it helped his knee pain more if he actually grabbed lower. So sometimes you see that. So if it's not working for you up here, you might try a different positioning of your hands, and it actually might work better. So he was actually down here. Same thing, that he would rotate inward, so toward midline, and then rock forward. Okay. So in most cases, though, it is going to work better to grab up high. Okay. So that's mobilization with movement for tibial internal rotation. Do the exercise 10 to 15 reps. It should be pretty much pain-free. Check your motion when you're done. Whatever was painful, squatting, check it. And if you have more range of motion and no pain or less pain, then it's probably a good exercise for you. But as with anything, check with your physical therapist or your physician before performing this exercise to make sure that it is appropriate for you. Like us on Facebook, like the video, and if you have any requests, let us know in the comments below. All right, thank you.